Hey everybody, Dr. Shadi, Ireifej here, board certified surgeon, chief of specialty, part owner of TrueCare for Pets, Studio City, Los Angeles, California. We are here today with Lindsay.
Hey.
Lindsay's here. We're going to talk about some things that, from our standpoint, absolutely mortify us.
Yep.
Things that you come in with your pet and tell us have occurred or what you've seen, and we're like, oh my God, why? So, and some of you may have gone through this. Some of you may actually be the culprits in this.
Sorry.
Yeah. Sorry if you had this coming. You deserve this. So we'll just, and there's no really categorization with these. It's just simply just going through things that we just can't stand hearing or seeing. So I'll go with the most obvious, and we actually have a podcast about this, the e-collar.
Dun, dun, dun.
Jeez. So, I mean, we ask you to place e-collars on your pets for actual medical reasons, not just because we want you to torture your pet or end up with a bunch of scratches on your legs or have lamps, vases knocked to the floor because your 200-pound Great Dane is knocking everything over the e-collar. We don't enjoy that. That's not the goal. And you can tune into our other podcasts regarding e-collars if you want to. But if you're supposed to have an e-collar on your pet and you come into the hospital and you don't,
we die inside a little each time.
We die inside.
Just a little bit.
So keep those e-collars on until we tell you it is okay to take them off.
But why would we want you to do that? It just sounds stupid, right?
Just silly.
We're not is masochist where you like causing pain to other people?
Yeah.
We're masochists. We want you to suffer. No, doctor asked you to do it for a reason. Usually it's to protect something from the dog's mouth, which can cause infection. We're not in the 70s anymore. We don't think dogs licking things helps it heal.
Yeah. Yeah, we're over that.
We're over that. So yesterday. So put the collar on, people. Just do it.
On.
If you hate the e-collar, listen to the other podcasts. There's tons of options. Soft ones, donut ones. I don't know.
Yeah, people get quite creative with these, you know.
It's amazing. There's ones that turn your dog like into a lobster. Genius. Like, we posted a picture on our Instagram of the one where the dog would turn into a flower.
Oh, that's right. Yeah.
Yeah, there's like lobster ones. Like, make it cute. Those are soft and they're cute, and you get to laugh at your dog for a week or 10 days, however long. You know, enjoy yourself.
And sometimes you get lucky and you can put like baby socks or something on the area of interest instead of an e-collar, or you can put a sweater on, like a dog sweater or a human like t-shirt or something to protect an area that prevent licking. Some dogs do well with those types of things, but that's a discussion between you and your veterinarian. But if we're asking you to put an e-collar on, you keep that thing on until we tell you to take it off. What else?
Okay, my next favorite one after that one. New consults, rechecks, whatever it is. My dog was really painful, so I thought I'd give it Advil because that's what I take.
Uh-oh. Oh boy.
No.
What's wrong with Advil, Lindsay?
It's an instant facepalm. That's what's wrong with it. Advil is toxic to your pets. Don't do it.
Yeah, it's always a good idea to make sure if you're going to give a medication that you bought for a human being at a human pharmacy, check with somebody to make sure it's okay for your pet.
And that someone is not Dr. Google.
Oh, God.
Call your vet's office.
They'll be happy to tell you.
Yeah. And if they say, oh, we need you to come in, there's a reason for that too.
Yeah.
They're not just trying to make money off you, I promise.
If you have medication left over from your other pet and you just want to give that pain medication to another pet of yours, don't do it. You need to make sure not every pet can handle every single medication. There are some screening tests that we do before we give you medications for pain or inflammation. So don't assume because your other pet had this medication prior that your new pet can get the same medication. Call in the office and check with them before doing that kind of thing.
Especially the doses might be off too. Maybe your one dog's 60 pounds and your one dog's 40 pounds, and you're like, they're roughly the same size. They're not.
Yeah.
No.
Yeah. Always check.
It's not a good thing.
Now you're trying to you maybe trying to cut corners or save yourself a trip to the vet or save some money, but if you end up with Advil toxicity,
you just cost yourself a whole lot more
money.
A lot
of money.
Yeah.
And potentially put your pet at risk of illness or even death. It's not good.
Okay.
Or even death.
Death. Dun, dun, dun. Okay. Next one.
How about sutures are missing?
Fluffy's here for suture removal. Great. I take him back, show the patient to the doctor, Dr. Ireifej in this case, and there's no sutures to remove.
Your pet was allowed to remove the sutures themselves. Yeah. That is not okay. We want the pet to come back with the same number of sutures that we put in, not less. Definitely not more. That would be weird.
That would be weird.
Where did these other ones come from?
Yeah.
So it goes along the same lines as the e-collar, but your pets can't lick the incision. If you haven't had a recent surgery, whether you see stitches or staples or you don't see anything, they can't lick the wound. So we don't want to have the pets removing their own staples or sutures.
E-collar, friends. E-collar.
It goes back to the e-collar.
Yeah, it does. It does. Along the same lines, I love when they come in for those follow-up appointments and you decide as the doctor, I want your pet to be on 10 more days of antibiotics. And they're like, oh, don't worry, I have 30 more pills. And you're like, you should have been out a week ago.
Yeah, this is a big problem, guys, on a global scale. I mean, this is considered a medical threat to some extent, that we're developing these superbugs. These bacteria are getting more and more resistant, like MRSA being the more famous one, where if you give a bacteria just a sampling of antibiotic, just a taste, a little bit.
Here you go, sweetie.
And you don't kill all the bacteria because you didn't finish the course of medication your doctor prescribed to you. Now the bacteria that have been experienced to that antibiotic are able to reproduce and develop superbugs. Little bacterial children that are now resistant to the antibiotic you were supposed to give in the first place. That would have worked.
The Shining twins.
Oh, it's so creepy.
They're here to stay.
So
Yeah, don't do it. Finish as prescribed,
finish the course.
Please.
Yeah.
If you want to stop, because maybe you have a valid reason. Maybe you were giving your pet an antibiotic and it's been throwing up on it, and you're pretty sure it's the antibiotic, and you want to stop. That's fine. Just call us. Let us give you the advice.
Let us tell you to stop the antibiotic. Sometimes we do that. We stop it temporarily for like a day or two until the gastrointestinal signs are resolved. Other times we stop it completely because it's not worth it. Your pet just can't seem to stomach it, and those are exceptions to the rule. For the most part, your pet and yourself should not have leftover antibiotics. You should finish the course.
Yeah.
That's a good one.
Bandages.
Yeah.
So good. I think we posted one of these. Didn't you post that one on Instagram?
Yeah, a few weeks ago.
So when we put a bandage on your pet, cat or dog, we intend it to stay there in the way that we put it on. So a lot of times pets will walk back in the office, I don't know, a week to 10 days later. And if you go on our Instagram, you could see one gleaming, beautiful example of what not to do. So that owner wrapped it in what?
They had it in like a men's belt, a safety pin, some like over-the-counter medical tape, a dress sock. Like some gentleman out there is missing half their outfit because of this bandage.
I didn't know about the belt. That's impressive. It's
absolutely insane. And then they use like ace bandage material and whatever. And then this dog ended up having swelling because the part of the bandage was too tight that the owners put on there, and additional sores that were not there beforehand. So you need to not make your own belt, your own bandage.
Yeah.
You need to bring them in for us to do the bandage ourselves. And so if a band, we deal with bandages a lot here, obviously, because I perform a lot of orthopedic surgery. And so we want to make sure that if the bandage at all is soiled, if it slips or it gets wet or your pet is bothering at it, those are all issues. And they are issues that I would consider actually medical emergencies. You come in, no matter what time of the day or the night it is, you come in, get that bandage changed, because you will have a scenario that almost risks or can risk losing your pet's leg if you don't have us attend to that bandage complication immediately. Just this week, we had a dog today that had dirt that somehow went into the bandage in between the toes. And then a few days ago, we had a foxtail. We covered the bandage, including the toes, and still, the owner admitted, of course, that this dog had been hanging out in the bushes. 2 large foxtails went through the bandage between the toes and got lodged in the skin. And for those of you who live on the East Coast or are not familiar with foxtails, they're these like dreaded plants, like little arrows.
They're part of a weed. They pull off. It's like a seedling kind of thing where it's supposed to like dig into the ground and procreate itself. I don't know. I'm not about plants, but something happens.
Not about that plant life.
they make more plants, but these things are the devil. They have sharp little points and they will dig into anything. I've seen them inside lungs. That's a whole different topic, but there's no way in this green earth that your pet should have a foxtail in its bandage, because if it has a bandage on, most likely you were told to limit its activity.
Those bandages are at least 3 layers thick, and they're quite large, especially in dogs of this size in this particular example. So that's a lot. That's a lot of bush activity.
I'm so proud of yourself on that one, aren't you? Oh my God.
So we want to make sure that you maintain a nice, clean, dry, intact bandage. And if it gets messed up in any way or your pet's bothering at it, you either call us, make sure that you don't have to come in, or just come on in, because we're going to tell you to come in. Those are considered emergencies. And
for those owners that have financial concerns, that's probably why we saw a belt used as a bandage. You're actually, again, probably going to cost yourself a lot more money trying to do things like that to save yourself money. So if it's that finances are stopping you from bringing the pet in because it got soiled, something happened to it, maybe check with your veterinarian, see if they're comfortable sending you somewhere where it's a little bit cheaper, or maybe they'll cut you a break if they understand your situation.
Just tell us. Just be honest with us.
Yeah.
Just tell us.
If Belt Guy had called me and said my dog needs a new bandage and I only have, X number of dollars, I still would have given that dog a new bandage. I can't speak for every veterinary hospital, but we're here to help you guys, especially with these long-term bandage management situations, as long as you don't make stupid choices repeatedly. Like if you come in every 3 days because the bandage is wet, then I'm just going to slap you and probably charge you double.
There's a problem.
But follow the instructions. Keep them clean and dry. Keep the e-collar on them. How many times I've seen the pet come in and the toes are sticking out at the bottom of the bandage, and obviously the bandage was covering the toes, and now they're 16 times the size they should be, like that other patient. Don't let it happen. Put the e-collar on.
Agreed. So another frustration of ours is relates to appointment time. So we try to keep a very tight day, and just like your own doctor who sees appointments throughout the day, we'll see anywhere from, at least for specialty, anywhere from a handful of patients to like up to 10 or sometimes even more, depending on the hospital. And the emergency doctors will see like tons of appointments a day. So if you have an appointment, an actual scheduled appointment with a specialist or with your family veterinarian, you have to try and adhere to that appointment. Show up on time or a little bit early so that they can see you. They are doing their best to try and get everybody in and out in an efficient way, but also give everybody else the attention they deserve. So we have a lot of problems where clients will not show up, not let us know they didn't plan on showing up, or they'll just call like that day and cancel the appointment, which is fine. Things happen. We get it. Most of the times when we call these owners up to follow through with this, they're like, oh, I thought my son called you, or oh, I didn't think I had to let you know that I wasn't going to show up today.
Because they're jerks.
Yeah. Like, how selfish.
Get it together, people. Call us.
Let us know if you're not coming in. It's fine. Like, we don't charge you to cancel the appointment. It just let us know, because somebody else could have had that appointment and you just took up a spot.
And I don't know what it is about LA. I don't know the people listening to this where they're at, but nobody arrives on time in LA. And I grew up with if you're running late, you call and say, hey, I'm running late, so that the office can let you know if they can accommodate you. They can maybe see the client that's already here waiting first. People don't even call us to tell us they're running late. We call them 20 minutes after their appointment, which is a 30-minute appointment. And they're like, oh, I'm around the corner. And I'm like, okay, great. You have 5 minutes left of your appointment time. And they don't get it. They expect us to push back everyone else's appointment to accommodate them. But if they were the person after them and now they're waiting 25 minutes because the person before them is a jerk, they wouldn't be happy. So be mindful of that. Give us a call if you're running late. Maybe we can fit you in still, which we usually do, but us having the heads up allows us to maybe make some changes in our schedule so that we don't get backed up or behind and everyone else suffers through the day because you're inconsiderate. Sorry, you know who you are. Or
also showing up at a facility that requires appointments. So we're very good about taking care of walk-ins, which are those folks that don't have appointments, that they just kind of show up. As an emergency hospital, every single person that comes in is a walk-in. We don't have appointments for emergencies because they're by nature emergencies. You can't predict them. But for us as a surgery department or internal medicine or other specialists, we work on appointments. And for you to just walk in and expect to see the specialist. It's just not how the world works. We have appointments. Now, obviously, if it's an emergency, you just show up. Anytime, day or night, holiday, weekend, doesn't matter, you show up. But if you were expected to come in, let's say 2 weeks after a surgery, to have a surgeon take a look at the incision or modify medications, that implies an appointment, not just showing up.
And I don't necessarily understand why people don't get this, because a human specialist takes months to get an appointment with.
Goodness, forget it.
And you show up 5 minutes late and they're like, nope, sorry, we can't see you anymore.
You're done.
But they think veterinarians are like these superhumans that can somehow be in two places at once.
We are pretty awesome.
But we're not. We're human beings. We can only fit in a day what we can fit in a day. And that is based on clients showing up when they're supposed to, not coming when they're not supposed to, barring emergency situations, of course. And being mindful of our time. And I've had clients that are running late and I tell them, okay, that's fine, but I'm going to have to, when you get here, maybe take your pet straight to the back for a quick exam with the doctor, and the doctor will have 10 minutes to talk to you. And then they're upset about that. Well, why am I paying full price? I should be paying less. And I'm like, no, you're paying for the time of the doctors that you took, that you use sitting in your car, but that's still your choice. If we do try to squeeze you in, you have to be mindful of the methods that we are able to use to make that happen, and be, I guess, accepting of it, if not appreciative of it.
Yeah.
I showed up 9 minutes late to my appointment at Kaiser one day because they had like a 6-level parking structure. I couldn't figure out how to get out of it. It was one of the big ones. They wouldn't see me.
Wow. And how long did it take for you to make that appointment?
Over a month.
Yeah.
They wouldn't see me. I was 9 minutes late.
Yeah.
If we did that to an owner in a veterinary clinic, that owner might stab us.
Yeah.
And the Yelp reviews, forget the Yelp reviews.
Oh, yeah.
You know?
Yeah.
But we're held to a different standard, and it's a little unfair.
Yeah.
Life's not fair, though, I guess.
Yeah.
Be nice to us, people.
I think that's probably a whole other podcast by itself, is the difference between human medicine and veterinary medicine, because there is financial reasons why, there's emotional reasons why, there's reasons why these differences exist, but we can say that for another time. It's a whole different discussion.
Are you proud of yourself? You came up with a different discussion.
Whole discussion. There's something. Oh, and then for veterinarians, for veterinarians who are referring cases to us as specialists or to the emergency department, we need those medical records sent over here. There's no point in having the owner show up on time, ready to meet with the surgeon for a nice 30-minute or 60-minute appointment, whatever it is, and have no records available from your past history. We need those records. And now with everything being digital, we can email us all the x-rays in seconds and we'll get them. X-rays, blood work, records, we need it all. I overheard a conversation today that was amazing. So the assistant to our internal medicine doctor was calling a referring vet who the appointment was now here, and her conversation with the receptionist at the referring vet was hilarious. She's like, I called you 4 times yesterday, and each time you said you would send them, and I still don't have them, and now it's the next day and the owner's here. Unbelievable.
And the lady was like, well, who did you speak to? And the doctor's assistant had Susie, Julie, and you.
Oh my goodness, ouch.
I thought it was so funny, and it's humorous, because it's like, you want us to consult on this case, you send the client here, but you can't get us the medical records so that we can do our job appropriately. That doesn't reflect badly on us.
No, I mean, it's an efficiency problem, and it's also a professional courtesy problem. I mean, it's just not right. And now the owner, I have to tell them, like, there's no way that I can avoid throwing your office under the bus. Because we've tried on our end to get the records sent over here. This appointment was made days or a week or so in advance, and now it's the time of the appointment and there's still no records here.
And my favorite is the owners tell me in the room, when I explain to them that I don't have the records, the owners will tell me, oh, but my regular vet, when they told me to make this appointment, said they were going to send them right then. And I'm like, okay, well, they didn't.
They didn't.
All of our faxes come through electronically, so it's not possible for us to lose the paper medical records. They're all searchable because we're all digital. It's digital age. So if you're a pet owner listening to this, I would say be a little more diligent also. Maybe when you leave the vet, ask them to give you a copy of those records or send you a copy of the records, send you a copy of the x-rays so that you also can walk in with them in hand if you remember. It's just helpful.
Absolutely. Good. I would say we covered a lot of, do you feel better? Like therapeutic.
It was very cathartic.
We just
Sorry if we offended.
Vomited up all of our concerns, all of our annoyance. Yeah, so I hope that sheds some light as far as on our end, these things that really terrify or annoy us, and just be more conscientious of these things. So we're just here to help, and whatever we can do to make the process easier for you as pet owners, for you as veterinarians, to help your pets get better. That's what we want to do. Thanks guys for listening. It's Dr. Shadi Ireifej here and Lindsay.
Bye.
TrueCare for Pets. Take care.
Bye.